Now to a crucially important issue that isn't getting sufficient coverage. The plight of all those on elective surgery waiting lists. We saw what People Power did in changing the Victorian government's ban on IVF treatment, and we need a similar campaign for elective surgery to resume. Data released this week showed the number of Australians waiting more than 12 months for elective surgery has almost tripled just in the past year. This hardship is being caused by the decision to cancel elective surgery, even though many of the surgeries cancelled do nothing to alleviate pressure on the hospital system. We're not having those specialist doctors and nurses redeployed elsewhere. Early this month, the Victorian government announced elective surgery will temporarily be reduced to urgent procedures only for public and private hospitals in metropolitan Melbourne and major regional cities across Victoria from Thursday, 6th of January, to help hospitals respond to the increasing number of patients with coronavirus. The government's enforced decision to restrict elective surgery has impacted thousands, including cancer patients. The Royal Australasian College of Surgeons representative to the Cancer Council Victoria, Dr Nicole Yap, she's seen firsthand the negative and in some cases potentially fatal impact these restrictions have. She joins me now from our Melbourne studios. Dr Yap, thank you for your time. You specialise in breast cancer surgery. What kind of disruption are you experiencing and what is the impact on cancer patients?
Thank you, Rita. Well, I am not just a breast cancer surgeon, and this has thrown a little bit of confusion amongst this whole situation with banning elective surgery at this point in time, because I'm an oncoplastic surgeon, which means that I not only deal with the breast cancer, but I also deal with the reconstruction at the same time, often during the surgery. And the problem with that is that when they ban surgery to do with reconstruction, which is fine for the majority of people in Victoria, not so much in New South Wales, because there's quite a few other surgeons that do what I do in New South Wales and in other parts of Australia. But commonly in Victoria, there's a breast surgeon and a plastic surgeon. So the breast surgeon does the cancer surgery and then the reconstructive surgeon does the rest, and that can be done potentially at a later date, but not in my surgery. And the problem with that is that there has been a lot of confusion as to whether I can proceed with the appropriate treatment. For example, if I take out a lump, otherwise the cancer, a wide local excision, and then if there's a large breast, in order to decrease the contour defect after radiation, I will do a breast reduction technique. I've been told, oh no, you can't do the breast reduction part of it. So I can't complete the surgery properly, and that is really difficult. So I've had to become a patient advocate, not just a surgeon.
Well, yeah, you shouldn't have to do that. And the term elective surgery in itself can be quite misleading because you've got people in pain, people who are really in desperate need of treatment, and they're now waiting long periods of time to get that treatment.
I've had a couple of patients. So I've got one who is running around in her early 40s with one breast. Now, she was scheduled for her reconstruction just before the bans hit, and she's totally distraught. I think it's totally unfair. It has not only impacted her, but her family, and just her overall well-being. So that's just one instance. The other was a patient who, due to COVID reasons, she was supposed to have been operated on in the public hospital, but couldn't get her operation performed. She needed quite a complex procedure, a bilateral mastectomy and immediate reconstruction with lymph node biopsy. So 8 weeks down the track, she sought me out. And because I do this quickly in the private system at that time, we had to do it then. Once again, I pushed for it because she needed it done. And because of the delay, she now has to undergo chemotherapy and radiation treatment, which may not have been necessary if it had been done at an appropriate time. So,
are we causing more problems? Sorry, go on.
Well, my premise is that early intervention saves lives. And I've just outlined that with that case then. That we are causing more problems with what you've just said then. The problem is that we're going to have a massive crisis once this is over and done with. And the repercussions of this will not only cost the public dollar, but it will mean that the patients will need to have further treatment, such as chemotherapy and radiation, which they may not necessarily have required, and their prognosis is also decreased. Bearing in mind that 20% of patients will be under the age of 50, and cancer in these age groups is actually quite biologically aggressive. So these people are also waiting indiscriminately. They don't even pick out the ones that can have a worse prognosis. So it's a bit of a shambles, and I'm only talking from my point of view. I'm sure this is across the board with other cancers, heart conditions. Look at orthopedics. If you have pain because you can't get your total knee replacement, you're sitting around because you're immobile. Effectively, if you're sitting around because you're immobile, you could develop a deep vein thrombosis, which is what you can get if you go on long plane rides, and that can then become clots to the lung, and you can die from that. So what do you mean that we do things in surgery not because we are having fun doing it, it's because the patient requires it.
Absolutely, and you're so right. This singular focus on one issue and neglecting all other health issues is going to have all sorts of ramifications. And we're hearing that warning from specialists like yourself, and that they've got to listen. We saw them overturn the IVF ban. That was supposed to be in place for 90 days. After a couple of days of a sustained backlash, they did a backflip. It's gone. Is that what we need to do here? Do we need people to advocate like yourself loudly and get these stories out there of people whose health outcomes are going to deteriorate significantly if this ban isn't reversed?
Well, I know the College of Surgeons, because I'm very closely associated with what they're doing at the moment, as well as the AMA, because I was the College of Surgeon AMA representative at one stage, so I know what's going on there for that reason inside. They're having multiple talks with the government, but it doesn't seem to be having any effect. They don't really seem to care about people. I'm not quite sure what's going on in that respect. Maybe they feel they can't. I don't know. But I think it's very important to realise that the admissions to hospital from COVID at the moment has decreased, and we know that if we are double vaccinated, and specifically if we've had the booster shot, we're less likely to be hospitalised from the Omicron variant. Then why are we continuing like this when they haven't given us a date when they think it will finish? And that's another problem, because we're left wafting in the breeze wondering when we can help people that really need help.
Dr Nicole Yap, thank you so much for your time this evening, and thank you for advocating for your patients.
Thank you, Rita.